Hello everyone, I am Dr. Rohit Solanki. Today we are going to discuss one very interesting topic, pediatric tumor. So, pediatric tumor को दो भागों में बांटा गया है. पहला सुप्राटेंटोरल एंड सेकंड वन इज द इंफ्राटेंटोरल. सुप्राटेंटोरल जो कि टेंटोरम से अबोव या फिर ऊपर की तरफ से ओरिजिन लेगा. इसमें मेनली ग्लायोमास होते हैं, एम्ब्रायोनल ट्यूमर्स, कोरोइड प्लेक्सस ट्यूमर, केरेंजियोफेरेंजियोमा, जर्म सेल ट्यूमर और पिनियल रीजन ट्यूमर. पीडियाट्रिक एज ग्रुप में ग्लायोमास में मोस्ट कॉमन जो ग्लायोमास होता है वो लो ग्रेड ग्लायोमा होता है. इसमें पाइलोसाइटिक एस्ट्रोसाइटोमा, डिफ्यूज एस्ट्रोसाइटोमा कॉमन होते हैं. अब जो पाइलोसाइटिक एस्ट्रोसाइटोमा है ये सुप्राटेंटल लोकेशन इसके एबनॉर्मल है. मोस्ट कॉमन लोकेशन फॉर द पाइलोसाइटिक एस्ट्रोसाइटोमा इज और इंफ्राटेंटल और द सेरेबेलम. उसके बाद में हाई ग्रेड ग्लायोमास आर द ग्लायोब्लास्टोमा एंड एनाप्लास्टिक एस्ट्रोसाइटोमा. सो फर्स्ट वन इज द ग्लायोमा. अंडर ग्लायोमा वी हैव द टू कैटेगरी. One is the low grade glioma and another one is high grade glioma. In low grade glioma, we have the pilocytic astrocytoma and diffuse astrocytoma. In high grade glioma, we have the glioblastoma and anaplastic astrocytoma. And third category is the diffuse hemispheric glioma. Now, this ends with the gliomas. Next one is the embryonal tumor. Embryonal tumor, we have the two which are arising above the tentorium. So, one is atypical teratoid or the rhabdoid tumor, ATAR. So, atypical teratoid or atypical rhabdoid tumor. Second one is CNS embryonal tumor with multi-layered rosette. So the two are the embryonal tumor. Another embryonal tumor is the medulloblastoma. Medulloblastoma is not arising in the supratentorial location. It is most common in the infratentorial location. So two supratentorial location embryonal tumor are atypical teratoid rhabdoid tumor and the CNS embryonal tumor with the multi-layered rosette. Third one is the choroid plexus tumor. In choroid plexus tumor, supratentorial, we have the choroid plexus papilloma and choroid plexus carcinoma. Next one is craniopharyngioma. In craniopharyngioma, most common craniopharyngioma in the pediatric age group in the supratentorial location is adamantinomatous craniopharyngioma. Next one is the germ cell tumor. In germ cell tumor, we have the two subcategory. First one is the germinoma and another category is non-germinomatous germ cell tumor. Next one is the pineal region tumor. In pineal region tumor, in pediatric age group, pineoblastoma is more common. Sometimes pineocytoma could occur. So here is one list of the supratentorial pediatric age group neurological tumor. First one is the glioma. In glioma, most common glioma is a low-grade glioma. In pilocytic astrocytoma, most common location is the infratentorium. High grade is a glioblastoma and anaplastic astrocytoma. Embryonal tumor, or there are three embryonal tumor in which two are the supratentorial. One is atypical teratoid and rhabdoid tumor. Another one is CNS embryonal tumor with multilayer rosette. Third one is the medulloblastoma, which is most common in our infratentorial location. Next one is our choroid plexus tumor. In choroid plexus tumor, we have to write the choroid plexus, then papilloma or the carcinoma. Craniopharyngioma, most common is adamantinomatous craniopharyngioma. In germ cell, we have two subcategories, germinoma and the non-germinomatous germ cell tumor. In pineal region tumor, we have either the pineoblastoma and pineocytoma. This covers all the supratentorial tumor in the pediatric age group. Now discuss the infratentorial tumor. In infratentorial tumor, most common is the medulloblastoma. This medulloblastoma is a subtype of the embryonal tumor, but it occurs in the infratentorial location. Next one is the glioma. Most common glioma in pediatric age group is low-grade glioma, in which the most common low-grade glioma is the pilocytic astrocytoma. So here most common tumor in the pediatric age group is pilocytic astrocytoma. Most malignant tumor in the pediatric age group is the medulloblastoma. Other gliomas are the diffuse intrinsic pontine glioma or the brainstem glioma. Next one is the ependymoma. Ependymoma is also common here. In 60% it occurs in the infratentorial location, 40% it occurs in the supratentorial location, and 10% it occurs in the spinal location. So far we have known about the medulloblastoma, glioma, in which pilocytic astrocytoma is most common, and ependymoma. Now, so atypical teratoid and rhabdoid tumor are common in both supra and the infratentorial location, and one is hemangioblastoma. So we have the pediatric neurological tumor, which are divided into supratentorial and infratentorial. Supratentorial are the gliomas, most common pilocytic astrocytoma or the low-grade gliomas. Embryonal tumor, we have the atypical rhabdoid and teratoid tumor. In choroid plexus, we have the papilloma and carcinoma. In craniopharyngioma is the adamantinomatous craniopharyngioma. In germ cell tumor, we have the germinoma and non-germinomatous germ cell tumor. In pineal region, we have the pineoblastoma and pineocytoma. Infratentorial, we have the medulloblastoma. Glioma, we most common is the pilocytic astrocytoma. Ependymoma, atypical teratoid rhabdoid tumor, and hemangioblastoma. This cover all the tumors of the neurological origin in pediatric age group. So we have few interesting fact over here. Location by age. If we are talking 3-year-old or younger child, then tumors are more common in supratentorial location. But in age group between 3 to 10-year-old child, infratentorial location tumors are more common. And again, in after the age of the 10 year, supratentorial and infratentorial becomes equal. So we can remember it wise. First, supratentorial common, then infratentorial common, and then after 10 years, both are equally have the incidence. Supracellular with the craniopharyngioma and optic hypothalamic glioma. Overall, most common is the pilocytic astrocytoma, medulloblastoma, and ependymoma. These are the most common tumor occurring in the pediatric age group. Supratentorial, we have the pilocytic astrocytoma, ganglioma, xanthopleomorphic astrocytoma. And infratentorial, we have the medulloblastoma, pilocytic astrocytoma, and ependymoma. So this is very interesting fact about the pediatric age group tumor. Most common pediatric brain tumor is the medulloblastoma, pilocytic astrocytoma, ependymoma, diffuse midline glioma, and craniopharyngioma. If we have the pediatric age group tumor, then we first have to think about these 5 tumors. Intermediate frequency tumors are the germ cell tumor, in which we have the germinoma and non-germinomatous germ cell tumor. Atypical teratoid or the rhabdoid tumor, choroid plexus tumor, in which we have the 2 papilloma and the carcinoma, and then pineoblastoma. And very rare pediatric brain tumor are the high-grade glioma or the glioblastoma, hemangioblastoma, subependymoma, DNAT, and CNS embryonal tumor with the multilayer rosette. This is the classification according to the incidence. So again, most common is the medulloblastoma, pilocytic astrocytoma, ependymoma, diffuse midline glioma, and craniopharyngioma. Intermediate is the germ cell tumor, atypical teratoid rhabdoid tumor, choroid plexus tumor, and the pineoblastoma. The rare pediatric brain tumor is the high-grade gliomas, angioblastoma, serpentine, DNA and CNS embryonal tumor with the multilayer rosette. Thank you so much. I am Dr. Rohit Solanki. Please follow my YouTube channel.